My name is Nosilari. You are welcome again in my YouTube channel. In this video, we are going to talk about fibroid. Okay, so please, if today is the first time you are seeing my video and you have not subscribed to my YouTube channel, make sure you subscribe because you are going to benefit a lot from it. In this video, we are going to talk about uterine fibroid, definition of uterine fibroid, types of uterine fibroid, causes of uterine fibroid, signs and symptoms of uterine fibroid, diagnosis of uterine fibroid, and prevention of uterine fibroid. Please, if you have not subscribed to my YouTube channel, make sure you subscribe so that you can get an alert anytime I post an amazing videos like this. Okay, let's go. Okay, what is uterine fibroid? Uterine fibroids are non-cancerous growths in the uterus. They vary in sizes and numbers and often develop during childbearing ages. Okay, now what are the types of uterine fibroid? Number one type of uterine fibroid is intramural. Intramural uterine fibroid is that type of uterine fibroids that are found within the wall of the uterus. Number two type of uterine fibroid is called submucosa. This is the type that bulge into the uterine cavity. Okay. Now, the number three type of uterine fibroid is called subserosal uterine fibroid. And this type of fibroid projects itself outside of the uterus. Okay. Now, the last type of uterine fibroid is pedunculated fibroid, and this is the type of fibroid that attach itself to the uterus with the use of what? Stock. Okay. Now, what are the etiology or causes of this condition? Number one etiology to uterine fibroid is hormonal imbalance. Hormones like estrogen and progesterone are the principal cause when it comes to cause due to hormonal imbalance. Number two is genetic factor. Okay, and another cause to this condition is growth factor and extracellular matrix changes. When there is insensitivity reaction within the growth factors and extracellular matrix, it will bring up changes that will lead to formation of uterine fibroid. So the most important last that causes this condition is lifestyle and diet, and also environmental influence. And that is why we advise people to always have a healthy diet and environment. Okay. Now, what are the signs and symptoms to this condition? Number one sign is heavy menstrual bleeding. We all know that normal duration for bleeding is within 3 to 5 days or 3 to 7 days. So if you are having menstrual bleeding that is up to 1 week, 2 weeks, this should be questioned. Okay. Now, the number two cause or symptoms to this is pelvic pain or pelvic pressure. Okay, the individual might also have something like frequent urination because due to the fibroid, we have the tendency to press on the bladder because it's very close, and because of that, we frequently cause individual to have frequent urination. Okay, another symptom to this is constipation. Yes, and also backache or what? Leg pain due to referral pain from the abdominal down to the what? Leg. Another symptoms is reproductive issues. Yes, people with fibroid always find it very difficult to conceive due to the fibroid block the space that is meant for growth of the what? Fetus. So, and that is why reproductive problem is one of the sign of this condition. How can we diagnose uterine fibroid? Uterine fibroid can be diagnosed by performing pelvic what? Examination. Number two is diagnostic investigation like what? Ultrasound imaging and also magnetic resonance imaging. Yes, at times hysterectomy is also used to visualize the linings of what the womb to know if there is abnormal changes that can potentiate the cause or risk the person to have this what particular condition. Okay, how is it treated? Yes, fibroid is treated with number one, medication. Remember, number one cause of this condition is hormonal imbalance. Drugs can be used to regulate the way the imbalance in hormone happens. Okay, so there are drugs that are used for that particular for that aspect to treat this particular condition. So we also have non-invasive procedures and what minimal invasive procedures like myomectomy, which is what removal of the what fibroid is a surgical procedure also. Okay, we also have hysterectomy. That is when the fibroid have eaten deep into the whole of the what womb. Hysterectomy, that is removal of the whole uterus, is now an option, is a best option for save this particular individual with this condition. Yes, in conclusion, uterine fibroids are common and they are manageable. Early diagnosis and proper treatment can significantly improve the quality of life of anybody that is diagnosed with this condition. So at this point, we have come to the end of this amazing lecture. Please, if you have not followed Nurse Hilary, please follow my YouTube channel so that you will learn and also refer people to join this channel. Thank you.